Hi, welcome to this session. Scorpion is sponsoring a straight talk session called Medical Practices Share Their Best Practices for Recovery During COVID-19. Obviously, this is a huge topic across all of healthcare and especially in the world of dentistry. So today we have our guest, Dr. Richard Robinette out of Tennessee. He has a practice called Dentistry by Design. Welcome, Rick. Thank you so much for joining me today. You've had a long background in dentistry. Correct. Didn't you have, you even started in the military? Tell us a little bit about your experience.
Yes, I spent my first 10 years as a dentist in the Air Force. And one of the things I liked about the Air Force is they were top on infection control, which is the hot button today. And when I came out of the Air Force, I felt like infection control was a priority for me. And so I appreciate my 10 years in the Air Force because I got to live all over the world. So it was a great time. And I then came to Tennessee in 1992. And I've been here in this office ever since.
Wow. So you've seen some downturns in that time, I imagine.
Yes, and Tennessee, we didn't get hit as bad in 2008, 2009 as other people did. The Saturn plant was actually right across the street from my office. And when they shut down, then we had a downturn, and that was some tough times, yes. The biggest thing is you have to control your expenses because your income, you do the best you can to generate the income, but the way to stay above board is you just have to watch the expenses.
Yeah, we're all familiar with those margins.
That's right.
In dentistry.
Yes.
Tight. Yeah.
If we made half as much as everybody think we did, we'd be rich.
Right. Well, let's talk a little bit about what dentists have been experiencing recently. I mean, dentistry, everyone knows, has been really hit hard during the pandemic, probably more so than arguably than any other practice type in the medical industry. When were you able to reopen in Tennessee? And tell me about that. What were some of those, what did that process look like for you?
We kind of had an up and down process. We were originally supposed to open on April the 30th. And at 5 p.m. on April the 29th, the governor extended it to May the 6th. So that we already have everybody confirmed for that 30th and May the 1st. So you had to reschedule the next week all over again. And that was about the fourth time that people had been rescheduled, but they were all really good about it. And then when we opened on May the 6th, people were eager to get in. We haven't had trouble filling the schedule at all. We've had some people at the last minute get a little bit squeamish about the disease, but for the most part, we've had a pretty good schedule.
So tell me a little bit about how you're running what your capacity numbers look like right now. We've been hearing from other clients, it can be anywhere from 50% to 70%, but haven't seen a lot of practices really in that 100% yet. Where do you fall right now?
We're probably about 85, 90%.
Okay.
We're getting killed in hygiene. We have 16 hygiene visits a day, and some days we only have 9 people show up. We'll have 7 last minute cancellations. Now on my side, we've stayed busy. We did have one all morning patient that had to cancel today because her boss got exposed to COVID, which when you go back to the guidelines, then we can't see her for 14 days. So that wiped out the morning. So that was the first time we've had that. But there were so many people that had broken teeth or that were really wanting to get in that we've been busy. Now, we haven't been doing the exotic stuff. We haven't been doing the 10 implants or the 6 veneers or anything like that. It's been a lot of, crowns for broken teeth or root canals for people that were in pain or things like that.
Well, so tell me about what that new normal looks like in your practice now. I mean, what you mentioned, some of these guidelines that you're following. Tell me about what that looks like.
The new normal is everything seems to take longer than it did before to turn the rooms over. The ADA guidelines they gave us, there's like 14 questions they have to ask each patient. You have to ask them before they come in, and you have to ask them that day, plus take their temperature. That slows you up a little bit. Plus, we used to wipe the rooms down once, and now you have to wipe the rooms down twice and let them sit 3 minutes each time. So, you've added probably 10 minutes to each patient without actually doing any treatment. So that's what's been the difficult part. Our new norm, the team members wanted a gown a patient, which is kind of expensive. But what they've done is they first started out washing the gowns because we had gowns. We had disposable gowns that could be washed. We also had surgical gowns that could be washed. they've got now, they autoclave them. So they autoclave them at lunch and they autoclave them at the end of the day. So the gowns are actually lasting a couple of days before we have to pitch them. That works out
So,
well.
well, tell me about, so the PPE requirements have all obviously have changed. We're hearing that it's still difficult for some dentists to get their hands on really the necessary PPE that they need. Has that been your experience?
It has been. We ordered gowns back on from 2 different suppliers back on April the 26th, and we still don't have those gowns from either supplier. Now, my daughter works in promotional marketing, and she was able to find some gowns for us that met the qualification, but she probably spent 5 days on the phone trying to find gowns for us and other practices. But I was lucky because we do a lot of surgery. I had a lot of OR gowns before we shut down. And so that's been our saving grace, is that we're still working from that supply. If we run out, I don't know what we're going to do. Mask, we had a hard time getting masks. Masks were on back order for about 4 weeks, but we finally got some mask in, some level 3 mask.
Yeah, I saw some recent survey numbers that came through from the ADA last week, and it looked like across the board nationwide, gowns by far was the most difficult item for practice owners to get their hands on, whereas the masks seem to be getting better now, seem to be more available in general.
Yes, if you look at the ADA guideline, it said on the gowns you could wear them until they were soiled. Well, I had a couple team members that looked at it and they said, well, the CDC says we need it for every patient. And I said, what are we going to do when we run out of gowns? Because I'm looking out, we're going to be out of gowns in a week. And that's when they got creative and started autoclaving them and everything like that. The patients are glad we're wearing gowns. We actually got a few Google reviews in the first week complimenting us on how we were protecting the patients.
That's great. Actually, that was going to bring me to the communication. I had a couple questions on how you are managing communication first with your staff. How is that, like, in the process of reopening? You have now all of these new requirements. You yourself are probably trying to get your head around what all of this new process is going to look like. And then how was that in communicating to your staff? Was that simple? Was that difficult? How did you kind of get everyone on the same page?
When we were closed, I did what Roger Levin and a couple of people recommended. I watched the GlideWell webinar every day at noon. And so whatever I gained from that webinar, then I would then text my entire team. And so I stayed in touch with them every day while we were closed. So they kind of knew what to expect. And like I said, then we came back on the 29th, we cleaned the office really well. And we had a long discussion then. And then we had the next week delay. So they had a week to kind of digest, the new things. It was just getting comfortable for them. I had one assistant, she came in and worked the first day. I thought everybody did great the first day. I sent out texts thanking them for doing a great job and following the new guidelines. And that one assistant came in the next morning and quit at 9:30 in the morning, and we started at 8. So,
and do you think it was just overwhelming in terms of the expectation that was being placed on that?
I think it was. I think she was overwhelmed. I just sometimes I think she's got so much information, because like the week before I said, look, if you don't like what we're doing, you need to bring me information where you think it needs to be different. Well, she went and researched all these international journals. I mean, she probably gave me 10 articles from international journals. So I think it was just she overthought the whole thing.
Sounds like you did a lot of communication even ahead of opening, with your staff, which I can imagine really helped in terms of setting some expectations.
The patients, they really develop a relationship with the team members, and so they're kind of like buddies. I have one assistant's been here 16 years, one's 15 years, a hygienist is 13, and the front desk, my office manager's been here 12. So the patients have seen the same people over and over, so they're very comfortable. And when they see the team members being comfortable, then they're more comfortable. So for us, it hasn't been a problem. It's been really pretty easy.
You mentioned earlier that you got some reviews, some positive reviews coming back. I mean, what we've been talking to dentists, practice owners, well, and not even in just dentistry, but in different practice types too, is it almost feels like a reset. Almost feels like not just a reopening, but like patients are now coming in with new expectations that they didn't have before, right? Like you're almost kind of having to meet expectations new for the first time. How has that been?
one thing that I was thinking about today, I mean, it's just, I seem to get a lot more questions about treatment. I mean, they want to know more about the treatment than they ever did in the past. And I've seen this a lot. I really get quizzed 2 or 3 times by a patient, you know, the day we do the exam, the day we actually do the treatment. I mean, they're asking me over and over and over about the treatment. So that's where I've seen the most change with the patients.
That's interesting. So they want to know exactly what you're doing in their mouth, like how it's being done, so that they can make their own interpretation of the safety of that. Interesting.
Yes, and that's, you know, and you try to simplify it for them, but then they come back and they start asking you some complex questions. I'm like, well, I can answer that question, but you're going to have a difficult time trying to understand it. And so I try to compare it to, I've tried to make a lot of examples over the years, you know, like I try to over treatment plan. Let's just say if it's a humongous filling and I'm worried about it might be a crown and possible root canal, I always tell them that ahead of time. And I try to tell them, I said, if you get your brakes changed, I said, back in the old days, I used to turn the rotors too. So if you get your brake pads changed and then you find out they got the rotors turned, and now you have this bigger bill, you don't like that. You'd rather tell them you're going to turn the rotors and they only change the brake pads. So I try to use analogies like that to patients that they can relate to, and that kind of seems to help out.
Yeah, it sounds like they just really need to be, if they need more information, it might just be that they need to be assured that they're going to be okay.
It's a little more hand holding.
Yeah.
That's what I think it is. It's a little more hand holding. They're there and it's just like, okay, I'm here, but should I really be here? You know, that's the thing.
How have you approached your marketing strategy now, this kind of, as you've kind of, we're coming out of COVID-19, has it changed at all? And what are you focused on?
Well, my thing is, what I do is I'm very dependent upon Scorpion. Julie and I have a great relationship. And so I really follow her suggestions. And then we work on the keywords and we say, well, I want to get this message across. Like when we started reopening, we wanted to say we've always treated people with universal precautions, which means you treat them as they're infected. I mean, but we tried to spread the word. Yeah, there's going to be some changes, but we've always been doing a really good job.
Yeah.
And so that's been that. But I mean, when it comes to marketing, I'm really dependent upon what Scorpion tells me. That's marketing's my weak part. I can do, I think, very good dentistry, but the marketing part, I'm very dependent upon Scorpion.
Yeah, I mean, sometimes it's good to have a partner, an industry partner that can focus on that, so you don't have to. But yeah, we were noticing that as many, you know, were pulling budgets when they were closed, there was a lot of opportunity for low cost advertising. So those who did stay in the mix, you know, we're getting some really great deals on advertising. We're seeing those leads we're seeing those campaigns now really convert in a way that we have never before. So it's really kind of interesting, especially with this pent up demand. Do you feel that there's been pent up demand?
You know, when I was watching those Gladwell webinars every day, they talked about that we were going to come flying out of the gates and that we would be seeing more patients than we could handle. So my imagination was like, okay, it's going to be December. And which was, you just got more people because everybody's trying to use their insurance up. I haven't seen that. We were booked out solid for 3 weeks when we shut down. We're really only booked solid right now for a week, but we're booked solid. I mean, we have a hard time getting emergency patients in. Today we saw 3. We don't ever turn an emergency patient away, but we don't have any gaps for those people. But they just get worked into the thing. And what we do is we just make our days longer. Is what we do.
That's promising. You had said earlier that you thought you were maybe at about 85% capacity.
Yeah,
do you see?
Go ahead. I'm sorry.
Do you see yourself ever getting to 100%, given that it's taking longer to turn over rooms? Do you think you can get there?
Our numbers, what we've done is we've tried not to turn over the rooms as much. So let's say you came in and you needed 2 root canals and a crown. If you can tolerate that, we try to do everything we can in one visit. So we've tried to make your visit longer as long as you can tolerate it. So we're trying to learn with the turnover room, but our productions numbers for May were good. They were my average before we shut down. June, we're just a little bit ahead of the average. I am worried when we get further in the summer. what's going to happen. August and September is always slow around here, but I don't know if the students are going back to school or not this year, and it's,
Yeah.
That's always what's made it slow is when people went back to school, then they had school expenses plus fall sports. So that's where my concern's at when we get to August and September.
And who knows, so much should even change between now and then, it's
That is
right.
it.
It's hard to say. So, and I actually was going to ask you, as you look ahead toward the end of the year, has this changed some of the goals that you had for your practice for end of year?
That we were about, believe it or not, we were having a great year before the shutdown. We were about 15% ahead of last year.
That's great.
Then we were closed for 45 days. So my goal was I'd like to get back to where I was last year for my total. I would be delighted with that. Roger Levine, he said for us not to expect to be anywhere close to that number. But that's my goal. If I can get back to last year, maybe a little above, then I will be delighted.
Yeah, that sounds like that would be a fantastic win. Has it changed how your perspective in terms of the way that you deliver care? Have you experimented with any teledentistry at all, or do you plan to, or any other new methods like home delivery or anything else that might?
I thought about the teledentistry a lot, because they were saying, use it for your post-op calls or your treatment planning. Because I lost the one assistant, we've since hired a brand new assistant. Like, she graduates tomorrow from assisting school. We're really hurting on the front desk for bodies up there. So we might turn to teledentistry to do the webinar, to do the treatment planning, just because that can take so long. And so that's one place I'm looking at it. Our biggest thing is we're just trying really, really hard to make patients feel comfortable, because we are wearing so much gear now. The air conditioner's sitting on 68. So when the patients come in, they're cold. And so we immediately offer them blankets. So we're just trying to put the patients at ease.
Yeah.
We were having them sitting in their cars in the beginning, but now we're back in the 90-degree days now with high humidity. So because there's not that many, then we'll let the people come into the waiting room. Our waiting room's large enough that we can easily put 4 people in there, and they're really about 8 feet apart. And so that hasn't been. Go ahead. I'm sorry.
I think you hit on something though, when really thinking about, taking care of the patient, also thinking of kind of what they're experiencing. I think that's maybe challenging to do right now in some cases, given there's just so many more responsibilities placed on all of you and your staff, things you have to do. I think it's easy to forget maybe what the patient is experiencing, and that kind of concern for their own health too. The fact that they're taking a chance to come in and get and go to the dentist, they might feel, not sure about the decision. But I think there's a real humanness to what you do, it's so invaluable. That relationship, that patient relationship that you have and that your staff has with your patients, many of whom have been coming to you for many, many years. The fact that you're showing, like, we care about your health, we care about you as a person, and going like that extra mile, that touch of making them comfortable now is the time to do that, right? To go above and beyond and find ways to do that. It's not going to be overlooked at all.
Yeah, and I think you hit the nail on the head. I think that's the whole key, is making the patient feel comfortable and making them feel wanted and loved. And my team members are just great at that. They're all very good at putting the patient to ease, and then that makes my job easier, because I can just go do my job. I go do the dentistry because they've already taken care of all that for me.
Yeah, that's great. Well, we so appreciate you, Rick. Scorpion appreciates you and our relationship with you. And thank you for coming on with me today and sharing some of these perspectives. I think that others will learn from it too. And all we're trying to do is just kind of continue to keep the conversation going and make sure that we can learn from each other. So thanks for joining me today.
Thank you very much. I enjoyed it.